Hello, my name is Dan Press. I am the Chief of Cognitive Neurology at Beth Israel Deaconess Medical Center in Harvard Medical School. And I'd like to tell you about our project to develop a home cognitive vital sign to detect cognitive changes in Alzheimer's disease. Patients with mild cognitive impairment and mild Alzheimer's disease can have fluctuations in their cognitive ability. Sometimes this can be as simple as a worsening in cognitive ability from an infection or a change in medications. It's important that we detect that soon before cognitive function worsens and some bad outcome happens, such as a fall or some other injury. A rapid, accurate tool to monitor cognitive function at home could act as a cognitive vital sign, as an early warning detector for cognitive change. Rapid changes can be the sign of a significant health problem, and gradual changes over weeks or months could be a way of detecting disease progression. I'll be working with a team here at Beth Israel Deaconess Medical Center in Harvard's School of Engineering and Applied Sciences. My co-investigators are Maurice Smith at the Harvard School of Engineering and Applied Sciences, and John Torres, the Director of Digital Psychiatry here at Beth Israel Deaconess Medical Center. We've designed a test that can be done simply at home in the form of what's called a serious game. This means something that is almost fun, like a game, but measures a critical cognitive function. The test that we've designed is called the SWIM test, or the spatial working memory test. It's a simple test where people see dogs, then they see blue squares, and they just have to tap on the blue squares that had the dogs behind them earlier. Over time, the number of dogs adaptively increases to try to zone in or hone in on someone's spatial working memory ability. This test can be done on an iPad at home and very simply. We'll be using the MindLamp platform, which is a platform developed by John Torres, our co-investigator, so that we can monitor people's progression and how well they're doing on the task at home, as well as send regular reminders to remind them to do the task. And we can review the results on a simple dashboard. We've already shown that this test can be done by people with mild cognitive impairment and mild Alzheimer's disease by testing over 100 patients in our cognitive neurology unit, but we've not yet tried doing it at home with just patients and their caregivers doing it on their own, and we haven't tried doing it day after day to monitor people. Our goal is to use this test, the SWIM test, at home like a digital cognitive vital sign. If successful, we have really two goals. One is to measure sudden changes that could be due to delirium, but also to measure the gradual changes that could be due to the progression of Alzheimer's disease. Our hope is that this test could help clinicians monitor patients' cognitive status, and we can test new interventions to try to slow down disease progression.